But getting involved with AmeriPlan is exciting. We have one of the most powerful healthcare programs in the country today. And a part of that, a component of that healthcare program is the Karis Group. I get excited about that because most of you don't know do. I didn't expect me to live a year and a half to go. I'm here based on some of the things that the Karis Group has helped as far as my medical condition also. So without any further ado, I'd like to introduce the powerful man for the Karis Group. His name is Mike Martin. We're just excited, Mike, to have you part of this with us today because we all love the Karis Group. Give it up for Mike Martin.
Thank you, Kenny. Really appreciate it. Thank you, everyone, for allowing me to spend a couple of minutes with you this afternoon. I want to tell you just a couple of notes about the Karis Group and what we do to work with your members. But first of all, I just want to congratulate you on 20 years. What a tremendous accomplishment. And on behalf of the Karis Group, we're just delighted to be a part of your plan. I'm going to run through something quickly because we have some other great speakers who want to fill in behind me, but I will tell you that we are in the exhibitor hall just across the way. If you'd like to stop by afterwards, we'd love to visit with you and answer any specific questions you have. But let me tell you real quickly a little bit about the Karis Group. I think this is going to work. There we go. This is what we do for you and the plan members, and I'm just going to run through this real quickly. One, what we do is when one of your members has medical bills of $2,500 or more of out-of-pocket expense that they have to face, it triggers our service. And what we do is we come in and we mediate on behalf of your plan member with all of their providers, with the hospitals and the doctors. We'll end up educating your plan members on all of their options and what they have available to them. Then we advocate on their behalf. We take over the case for them. We do all of the advocacy work so your plan member doesn't have to be in communications with the hospitals or providers while we're working their case. We'll pursue a broad range of options to try to assist them with their medical bills. We of course try to get them first either covered by Medicaid. There's a wide range of Medicaid programs that people aren't even aware of that we can sometimes get plan members put on Medicaid, which would take care of all the bills, or we'll get them qualified for financial assistance programs. One of the IBOs visited with me this morning was talking about a friend of theirs who had over a $100,000 bill completely written off. And that's not uncommon, so we try to get them qualified for financial assistance programs if possible. And if those avenues don't work, then we end up actually going into an actual negotiation process. And as you'll see in a few minutes, we get some tremendous results for the plan members when we negotiate on their behalf. We're trying to negotiate a settlement discount, and sometimes we get all of it discounted or completely written off. And at other times we may get a portion, and we'll set up a payment plan, a reasonable payment plan for the balance. And then we work on communicating. We communicate. We stay with the plan member. We let them know where we are, the status of the project, so they don't have to worry about it. Then what we do just in a nutshell is, I'm going to tell you when a case is turned over to us, a case is opened with the Karis Group, we take responsibility for that case. So we get all of the medical bills from the plan member, and then we go off and begin to work that case. That plan member doesn't have to be involved anymore. Typically it will take us 45 to 60 days to complete working the case. But in that time, they're not having to hassle with doctors' offices and collection people calling them. We're taking total responsibility for the case. We'll pursue all of the avenues that we just mentioned a few moments ago on their behalf. They sign a medical information release form from the outset allowing us to speak on their behalf legally with their physicians, with the hospitals, but we pursue a wide range of options for them. Our goal is to get them the greatest discount that we can get. So we have a whole arsenal, thank you. We have a whole arsenal at our disposal to use. We communicate regularly. We set up a task for our staff to contact the plan member at least every 10 days, if not more frequently, if we need them. So we'll communicate with them throughout the process. But we do need the plan members' cooperation to assist us really at the outset, letting us know a little bit about their personal financial status so that we can tell their story. What we do is take it from being just a case file on someone's desk in a doctor's office or a hospital to a face, an actual story of an individual and telling their story, so that we can present it to them and get the best results possible. That is me making that noise, I'm sorry. I kept looking out the front audience saying, I wish that guy out there would turn his alarm off. Forgive me for that. Anyway, that guy down there is really being bossy. Anyway, this is kind of what we do for y'all. We get average savings of 30% or more per bill that we actually work. Our overall savings for our clients is about 50% of total bill dollars that we negotiate. Right now, for the past 12 months, our actual discount percentage for AmeriPlan members is 68.6%. Now what that means, let's just say you owe thank you. Let's say you owe a $10,000 bill. On average, we're going to save your member about $6,800 of that $10,000 bill. Sometimes we get the whole bill written off, sometimes some providers aren't as generous. So it is a best efforts attempt, and we always leave your member in good stead with the institutions that we're working with, so there's no reason that they would have any hesitation going back to that same hospital or doctor's office in the future. We're successful in reducing 3 out of 4 bills that we work, and as I mentioned, it takes about 45 to 60 days to actually get a bill, a case completed. Now, as you can see, this is our overall discount. This is actual report that we send to Dennis and Daniel Bloom each month, and it has, among other items on it, this dashboard that says this is what the last 12 months has actually done. I was sharing this morning that with a couple of the people that visited with us, we basically work on large bills. Now, your question is, well, Mike, what is a large bill? And our answer to that is a large bill is when you open it up at home, you say, oh my goodness, how am I going to pay this bill? And for all of us, that's different, isn't it? So we work on bills you know, that may seem to be small, but for someone, they're monumental, and we work those cases. I will tell you that the largest write-off that we've ever been able to get was for an AmeriPlan member, and it was $1.2 million off of a single bill. So it's a great benefit. We enjoy working with y'all, and we just want to thank you. Thank y'all very much. I'm over to the side. I thought of something. Hey, I'm going to take everybody out there and drink this evening. We need to be over in the lobby of the hotel. I'll buy